This video demonstrates the procedure of suctioning via tracheostomy using the open technique and should be used in conjunction with the OPIC suctioning via the tracheostomy clinical procedure. Explain the procedure to the patient. Ensure that the patient is well oxygenated. Pre-oxygenate the patient if required. Check and prepare all necessary equipment. You will need routine tracheostomy PPE as per hospital policy, a bottle of water to clean the suction tubing, appropriately sized suction catheters. For adult patients, this is usually French gauge size 12, and suction tubing connected to a functional suctioning system, Yankauer sucker, and a waste disposal bag. Switch the suction unit on and ensure the pressure is at an appropriate level. No greater than minus 150 millimeters of mercury is appropriate for most patients. Perform hand hygiene and put on PPE. Remove tracheostomy devices prior to suctioning, such as humidification interfaces or Passimure valves. When performing tracheostomy suctioning, a clean technique should be employed to minimise cross-contamination. Open the suction catheter packet to expose the thumb control connector only. Attach the suction catheter to the suction tubing, keeping the catheter tip covered. Transfer the tubing to your non-dominant hand. Apply an extra clean glove to your dominant hand. This hand can now only touch the sterile catheter. Remove the suction catheter from the packet with your dominant clean hand and grasp the catheter about 10 centimeters from the tip. Ensure that the clean catheter does not come into contact with anything else in the surrounding environment. Using your dominant clean hand, introduce the suction catheter into the tracheostomy tube without applying any suction. Advance the catheter until a cough reflex is stimulated or you feel gentle resistance. This is most likely the carina or where the trachea divides into two. Withdraw the suction catheter 1 centimeter and commence suction by placing the thumb of your non-dominant hand over the thumb control port whilst withdrawing the catheter out. The procedure should not take longer than 10 seconds. There is no need to rotate the suction catheter on removal, as the suction catheters have circumferential holes. The same catheter can be inserted a second time where there are copious secretions, as long as it has not come into contact with anything else in the environment. The catheter should not be rinsed between suctions. Note the amount, colour, and consistency of secretions. When the patient's airway is clear of secretions, disconnect the suction catheter and remove the extra glove on the dominant hand. Place the glove with the suction catheter in the waste bag. Rinse the suction tubing with water from the allocated bottle. For patients who require oxygen therapy, reattach the oxygen. Ensure that the humidification source is replaced over the tracheostomy once suctioning is complete. Ensure that the patient is comfortable post-procedure. Assess SpO2, respiratory rate, coughing or irritability.